Check, 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 check.
You guys can sit down. Good evening, family and friends, esteemed faculty and staff, and of course, the incredible Doctor of Physical Therapy class of 2025. Welcome to Western Michigan University. My name is Amy Heath, and I'm honored to serve as the chair of the Department of Physical Therapy and the program director as the Doctor of Physical Therapy program here at Western Michigan University. Tonight, I get to add one more role to that list, your Master of Ceremonies. It's my favorite. It's truly an honor to help celebrate this extraordinary milestone in the lives of our graduates. Family and friends, this evening is as much your celebration as it is theirs. Today represents years of effort, dedication, sacrifice, and perseverance by the graduates, and also years of support, encouragement, pep talks, and unwavering belief from you all. This moment is built on love and your partnership, and we thank you for standing with these graduates every step of the way. To our dedicated faculty, staff, and mentors, the backbone of this program, your impact cannot be overstated. You've been teachers, coaches, challengers, and champions. You've pushed these students to think deeper, work harder, uphold values that define our profession. The clinicians they are today reflect the knowledge, compassion, and professionalism you model every day. We are profoundly grateful for your commitment. Graduates, let's take a moment to give a loud and heartfelt round of applause to your faculty, staff, mentors, and loved one who helped lift you up along this journey. Without their guidance, patience, and support, none of us would be gathered here today. And now, to you, DPT class of 2025. Let's pause and really take in how far you've come. What a remarkable journey it's been, from the anatomy labs, where you've questioned whether your brains could hold any more information, to clinical rotations that stretched your skills and stamina. You've met every challenge with resilience and determination. You adapted, you pushed through, and you grew into confident, capable professionals we celebrate today. You've earned the title of Doctor of Physical Therapy. And with that title comes great pride and great responsibility. Yes, you've mastered the science of physical therapy, and more importantly, you've embraced the art of patient care. You've learned to listen, to empathize, and to see the whole person in front of you. Those qualities will define the kind of clinician you'll become. Today, you'll receive your doctoral hood. No, it's not a secret society initiation, though you certainly earned a spot in a pretty elite group. The hood symbolizes the depth of your academic achievement, the intensity of your clinical preparation, and the professional identity you now carry into the world. When you're hooded this afternoon, know that you're wearing every late night study session, every light bulb moment, every moment of doubt you pushed through, and every success you claimed along the way. Feel proud and know that this hood comes with the trust your patients will place in you. That trust is one of the greatest privileges of this profession. As you step into your careers, remember that today is not the finish line, it's your launch pad. The field of physical therapy is dynamic, evolving, and full of opportunity. Stay curious, stay flexible, keep questioning, keep growing, keep discovering, and challenging yourself to be better tomorrow than you were today. Take with you not only the knowledge you've gained, but the relationships, the teamwork, the shared struggles and victories that shaped your time at WMU. You are joining a global community of physiotherapists dedicated to improving lives through movement, compassion, and innovation. So this afternoon, we celebrate you and your bright futures. We could not be prouder of you, and we cannot wait to see all the amazing things that you'll accomplish. Please join me in congratulating the newest members of the physical therapy profession, Doctors of Physical Therapy, class of 2025. And now it's my great pleasure to introduce to you someone who's been an exceptional leader and champion for the College of Health and Human Services, Dr. Lillian Smith.
Thank you, and thank you all for being here this afternoon. Today we celebrate a momentous occasion, the graduation of our doctoral students in physical therapy. It marks the day of an accumulation of great work, perseverance, study, and most of all, just putting your nose down and getting it done. Day after day. This is a highly accelerated program, meaning that our students come in here and they work from early in the morning all day long in being in their classes and then studying, doing their labs, going to their clinicals. This is a full-time, full-life program, and you have gotten through. And for that deserves a round of applause. And during that time, you have had immense growth. I've heard it from the faculty, and I've heard it from some of you as well. You've honed your clinical skills. You've also demonstrated a profound commitment to improving the lives of others. And your hard work and determination have brought you here to this moment. As you step into your roles of doctors of physical therapy, you carry with you the responsibility and the privilege of transforming lives by helping patients to regain mobility, to be alleviating pain, and achieving higher levels of wellness. Your knowledge, compassion, and dedication will be the foundation of your practice. To our faculty, thank you. Thank you for your mentorship, your expertise, and support. You played a critical role in shaping these graduates into the skilled professionals that they are today. And as we've already said, thank you so much to our families and our friends. Your encouragement and your sacrifices have really been invaluable, and our students can't do it without you. Just absolutely cannot do it without you. Whether it's a phone call or a place to go on the weekend, something to look forward to for a break, some reassurance, someone to cry to, someone to laugh to. All of those little pieces and parts that we offer in being present in supporting someone else in their journeys just makes a huge difference in the professionals that they become and their ability to thrive in the profession as they go forward. So graduates, as you embark on your professional journey, please remember, as Dr. Heath has already said, we have to uphold the values that you've been learning here. Ones of empathy, integrity, the staying curious, the lifelong learning. Every day, things change. Every day, our professions evolve. Every day, something else is learned and gained. And sometimes that means we have to leave some of those other things behind. So lifelong learning is a piece of your journey as you go forward. And please know that wherever you are and wherever you go, WMU, the College of Health and Human Services, is here for you. Your faculty are here for you. And the friendships and the relationships that you forged through this living together for 2.5 years, you are each here for each other. So congratulations on this remarkable achievement. We're incredibly proud of you, and we're excited to see all of the wonderful things that you will do as you go into your future. Thank you.
Thank you, Dean Smith. Each year, the graduates vote for a faculty speaker. This year, they selected 3. So Dr. Carrie Barrett, Dr. Don Hoover, and Dr. Stacy Fruth will each give a set of remarks. Dr. Barrett is going to give her address first, followed by Dr. Hoover, and Dr. Fruth will deliver the closing remarks. Dr. Barrett?
Family, friends, Dean Smith, our program chair and director, Dr. Heath, faculty, instructors, our awesome administrative assistants, and the spotlight for this afternoon, class of 2025. I am humbled and honored to be asked by the students to speak at their hooding ceremony in celebration. I'm Carrie Barrett, Associate Professor here at Western Michigan University's DPT program, where I help to teach the physical therapy management of neuromuscular conditions. And the reason for me pointing that out is I thought it'd be a little bit fun to toss into today's speech some neurologic terms as to engage the students for neuroplastic changes. Why? Because salience matters. Right? So it's going to be fun like that. The outline will include us spending time, for the majority, giving you all a scope into their past and reflecting a little bit about where you came from. Then we'll spend a scotch of time on the present, and then we'll toss in some words for the future. So past, present, future with a sprinkling of neurologic terms. Good? Okay, cool. So, students, what was your very first memory of interaction with us in the DPT program here at Western? Perhaps it might have been interview days, where you were thinking, how do I look? How do I act? How do I smile without looking too cheesy? How do I show the program what a good fit I am for them, all the while trying to determine, are they a good fit for me? Or maybe it was orientation, a little bit of chest puffery because you got in. Who are my new people? Who's my group? How do I act? How do I wear? What do I wear? Where do I park? Or maybe it was maybe that first semester you were here, summer 2, where you had maybe gross anatomy, and you thought, it's anatomy. I've had anatomy. Been there, done that. How bad can it be? But maybe you didn't use it, so you lost it. Or maybe the application of anatomy hit a little bit different. Who knew that not only would you have to memorize the brachial plexus, but you also had to learn the roots, trunks, divisions, cords, and branches, and if one of those stinkers gets lesioned, how the heck does the arm move, right? You had to learn that. That's different. Or maybe it was the fun class of Dr. Weir's patient care management and mobility, where you had hands-on, always a fun class. You were learning how to transfer and provide gait patterns and fit assisted devices, and you're like, kinesthetic learning, I'm a PT. And then you had the first written exam, and you're like, uh-oh. Word comprehension applied to 3D kinesthetic learning is different. There's mental gymnastics involved in that. Possibly it was palpation, where you had pokey fingers and pinchy fingers, and trying to figure out where the popliteal pulse is. Maybe you were thinking the fibular head, who knew it was so distal-lateral on the leg? Maybe, hopefully, some of you didn't have any long-lasting nerve impairments from the pokey fingers and pinchy fingers. But at that stage of your learning, you were just throwing it out there. You were just seeing if you could move in a direction. Mobility, right? Mobility. Somehow you ended up in fall year 2, and the workload was like no other, right? Human movement, med-phys, both by Dr. Hoover, neuroscience with Dr. Santos, PCP, and then the clin exam skills, the heaviest lab-based course. Who knew practice had to be outside of the classroom, and practice, and practice, and practice? Why? Because repetition matters. And looking back, maybe the practice didn't have as much depth as you intended, or maybe there was challenges that you couldn't anticipate. And in the practicals, you're like, oh my goodness, belatedly, I didn't realize the demands were going to be so much more in my learning, because intensity matters. Somehow, at the end of fall year 1, you started feeling more settled. You started feeling like, okay, I know where things are. I have a place. Don't want to move too much, too far. Stability. Started to feel stability. Year 1, cardiovascular palm acute care with Dr. Preston brought back the skills from clin exam skills of blood pressure, heart rate, ABIs, except with different speeds, accuracy, patient positioning, your positioning, all different. Because you had to use it and improve it. Yep, I can see your lips moving. I know you got this. And you maybe still never learned where the popliteal pulse is, because that stinker is hard to find, but you were really getting good at blood pressure readings now. Human movement and med-phys too, yes, with the ever-entertaining Dr. Hoover was still in that semester, also with clinical interventions, PCP, and before you knew it, somehow you're passing the comprehensive anoscopy and heading into your first clinical rotation. And all you can do is hope and pray that transference of skills matter. And before long, you're acting like a PT, doing patient care, and you're thinking, this is why I'm a PT. I'm here for a reason. Until you get the forms from Dr. Webb and the due dates, and maybe the expectations if the due dates aren't met. And you're like, oh. Some of you may not have realized, which you probably realize now, that although our focus is on students, you're part of a bigger picture. You're part of one of the cogs of this big mechanics of the DPT program, where we have to track and look at different placement sites and see trends and help out with credentialing. Year 2 classes, Integ, Peds, Musculoskeletal 1 and 2, Neuro 1 and 2. You've got this. You're back at campus. It's like a family reunion, right? You're knowing where things are. You're having fun. Controlled mobility. Dr. Smith, Nick Smith, there's 2 Smiths here, so I have to be careful. Dr. Nick Smith is noticing that the guys group is starting to settle in, hiding different objects in each other's backpacks. You know, see, we talk behind your backs. And the quiet girls table, although quiet, were brilliant, AKA silent assassins. You teach us as well. Neuro 1 and 2, different in how we approach things, different in how We guard each other. Who knew pom-pom was different than PT guarding, Elise? Or that we needed to set up differently with multiple ways of explaining setup as far as anterior stepping strategies, Joya. I call this class of 2025 hashtag fall risk for a reason. But we informed each other's learning, is my point. We're a collaborative team when we teach. Folks, I am blessed to be around these fantastic, tech-savvy faculty who use Slido and Google Polls and all the fancy tech to understand what the students' feedback is. I am not one of them. I use Post-its. I just do. And at one point in time, I gave Post-its on seeing if the students understood content that we had gone over. And it was astounding for me that a majority of the students did not catch some of the content on Guillain-Barré, which is a condition that we were talking about. And this is a content area where they're already going out into clinicals soon. We are pushing them to Bloom's taxonomy with getting the concepts and then creating and designing and teaching each other. I couldn't fathom why they didn't get it. I was stumped. So I asked them. And it just so happened that something happened during break that shattered their concentration. And I mean literally shattered their concentration, which happens, right? Stressful events. I mean, if we're talking neuro, the amygdala signals the hypothalamus, cortisol, adrenaline, prefrontal cortex not working, inhibiting learning. What happened? Interference. Interference happened. Maybe due to the timing of life outside of the DPT program impacting DPT school, maybe timing mattered, or overall age mattered with maturation. Whatever the situations, at the end of your journey in CE1, CE3, or CE2, CE3, you started applying old and learning even more new skilled techniques, trying it on very specific conditions in patient care because specificity matters. You were starting to be more autonomous. You were starting to be more controlled in your mobility going into skill level, which brings us to the present, right? I invited you to take a moment and breathe it in. Breathe it in. Be proud of yourselves. Live right now, knowing that you earned it. Literally, some of you with blood, sweat, and tears. Lean into the celebration. Still make good choices. Future. We'll hear a lot of keep in touch, contact us. Come back and see us. And I 100% agree. My seed plant for this future is advocacy. This title of doctor, you have already been informed by two other presenters. Lifelong learning is part of it, but so is supporting and knowing that you have a new platform. Advocacy. For medical and payer system improvements or the institution, for your own mental and medical well-being, professional and personal. For most importantly, for those who have little voice or really just need your voice to speak for them. Community. This comes in all forms. Advocacy for inclusivity at your workplace, advocacy for more PT visits for your patient, or maybe it's even advocacy for basic human kindness. I encourage you to use your powers for good. Class of 2025, we are thrilled to see you graduate. We always will be here, your weird little dysfunctional DPT family, and we really cannot wait to see what you do. Congratulations. I will now be calling to the podium Dr. Don Hoover.
Let me say this about that. Thank you, Dr. Heath. Thank you, Dr. Smith. Thank you, Dr. Barrett. Thank you, fellow faculty and staff. Thank you, family and friends. I thank you for assembling here today to celebrate the WMU DPT class of 2025. And most importantly, thank you, members of the DPT class, for asking me to share a few thoughts today as we collectively honor your achievements. So toward this aim, I would like to briefly go through some take-home messages for the road. I've selected a few thoughts that I think are particularly appropriate as we simultaneously reflect on your accomplishments over the last few years, as well as anticipate the challenge that you're going to face in the years to come. Take-home message number one, you're amazing. Law school is hard. Medical school is hard. Earning a PhD is hard. Veterinary medicine is hard. Pharmacy school is hard. Earning a doctorate in nursing is hard. DPT school is hard. Only those who've gone through this process fully understand it. How it's changed them, how it's facilitated growth, the growth that we need to serve society in our respective professional capacities. In many respects, this can be summed up very nicely by the adage, everything that you've been wanting is on the other side of hard. It's been worth it. So here are a few of the things that you've learned getting to the other side of hard. Embracing discomfort. True growth happens when you push past what's easy. Consistent effort. Success isn't a single event in any avenue of life, but it's a result of stacking those efforts day after day after day. Do you better understand that now? Yeah. Consistent effort, which I just said. Building resilience. Overcoming hardship builds inner strength, character, and a deeper appreciation for success. Shifting your mindset. This involves reframing the challenges that you're facing as necessary steps rather than roadblocks, and then finding motivation in the journey itself. You've likely noted that Wolff's law of connective tissue physiology is not listed here. But this is no surprise because this process was never primarily about Wolff's law in the first place. Take-home message number two, you've grown a lot. Yesterday's research presentations were a great illustration of how you've grown. As I watched each of you present your research findings, at once I saw each of you as the DPT students of the first week of this program and the polished products each of you are right now. Back then, most of you were a jumble of anxiety, at once confident in your academic skills, but also unsure, more than a little bit nervous, and for the most part, not wanting to do something wrong, which may or may not include entering the Calhaven Trail if the sign says not to, but we won't belabor that point right now. Yesterday, you shined. Each of your research projects is on par with any done across this country, which is an accomplishment. But I think arguably more importantly, the research projects are symbolic of your growth in capacity to sort through fairly complex medical, societal, and cultural issues as is needed when working with patients every day in the clinic. The process works. I've learned to respect that. It's beautiful to watch. Take home message number 3. You're going to do great things. I believe this is a truth. This truth is one of the things that I've come most to enjoy about being a professor, which is watching each of you move forward and build a career in physical therapy and a life for yourself. On your own terms. Not on my terms. Not on Amy's terms. Not on Carrie's terms. Not on Stacy's terms. Not on the APTA's terms. Not on your parents' terms. Not on your high school science teacher's terms. On your terms. I've now been a professor longer than most of you have been alive. Grandpa Simpson standing up here, right? Telling you what it was like in the old days. I absolutely love going to class and I love working with students, but I've come to enjoy publishing research articles, but hands down, the best part of the job is witnessing what each of you will do with your lives. I'm proud to say that I have former students currently working in the National Football League, the National Basketball Association, and Major League Soccer. Others have started residency programs, become professors as well, led medical mission trips to less fortunate countries all over the globe. So many have started private practices that I've lost count. I can go on and on and on regarding my wonder and satisfaction in witnessing your own takes on your own careers and your own lives. Whether it's peds, women's health, hospice, healthcare administration, or any number of other very important clinical practice patterns. The commonality in all of these is that these former students, they've acted on their own visions for their own lives. And I encourage you to do the same. Ellie, knock him out in Tacoma. Jeff, show him what's up in Hawaii. Yeah? Jesse, build that gym and clinic. The world will be a better place for you realizing your dreams. Take home message number 4, you're loved. As every other speaker has noted, there's a lot of people who have invested in you. The list is long in each of our cases: parents, grandparents, siblings, extended family members, teachers, coaches, professors, romantic partners, friends, bosses, co-workers, pastors, priests, rabbis, imams, gurus, monks have likely also helped to guide you. In the wisdom of the African proverb, it takes a village to raise a child. Same is true of physical therapists. I acknowledge that I've likely left some people out, but not intentionally. So be sure to thank these folks after you walk across the stage at Miller Auditorium tomorrow. Most of you will go to bed on Saturday night as the first person in your family to earn a doctoral degree. This is an accomplishment that's something that's achieved by only 2% of people in our society. It's amazing. It's simply amazing. Despite all this support, though, each of you has also encountered adversity along the way. Each of you have endured stretches of hardship in this path. Most of you had moments of doubt that you could achieve your goal of being a physical therapist. I know I did a long time ago. The blessings in these hardships is that you've learned important lessons about the human condition. Your reward for learning this is to show others is now your obligation. That's your obligation. Pay it forward. You're going to go forth as a doctor of physical therapy, and you're going to aid others in their stretches of hardship in their lives. You're going to help them to restore their health and their wellness to the extent that you're capable. You're ready to do this. Take-home message number 5. Your Broncos. I acknowledge that I did not understand this point very well when I was in graduate school. Looking back, I see how I was too focused on things like getting good grades. Mistaking at that time the notion of good grades as some sort of linear relationship predictor of the life I wanted for myself. Grades don't matter. It's easy to say that now, but I didn't realize that when I was in graduate school. But that's not how any of this works in this thing called life. 35 years later, I look at the graduate school experience very, very differently. I much more easily see the relationships we form with our classmates and professors as the single most important attribute of this experience. In this moment, I'm trying to help you in your youth to see all this that I was blind to. Life is a team sport. Always has been and always will be. The above described changes in our collective capacity to embrace discomfort, create consistent effort, build resilience, and shift our mindset is the real reward of graduate school, not our GPAs. You did this together. You helped each other get through this chapter of your lives. In this process, you've become part of a community. A community that includes at least one Prius driving Packers fan. Things are different in the Upper Peninsula. Whatever floats their boat, Thank you for coming to Western Michigan University to complete your graduate training. We are all better because of it. In closing, thanks for letting our faculty play a small role in this phase of each of your lives. Please keep us in your thoughts and prayers as you move forward. You'll certainly be in ours. Thank you.
Good choices, students. Thank you both, Dr. Barrett, Dr. Hoover. We're now going to acknowledge several awards and recognitions. In doing so, we're going to have multiple faculty members come up to the podium to present. I'm going to begin with the department awards. So students, for these awards, I'm going to ask you to come to the front to accept your award, okay? First award, Outstanding Applied Discovery Award, Group Project. The Outstanding Applied Discovery Award Group Project recognizes the work conducted by a group of students under the advisement of a faculty member to create, conduct, and complete a research project while enrolled in the DPT program. The group that wins this award is selected via input from faculty and external reviewers during the presentation day that we had yesterday. I'm pleased to announce that the winners of this year's group award are Olivia Brunner, Connor Lynch, Juliana Roller, and Chloe Tomasic, with faculty mentors Dr. Rodney Weir and Dr. Heather Renter. In addition to the group project award, we also have an individual award. So let's see here. The Outstanding Applied Discovery Award Individual Project recognizes the work conducted by an individual student under the advisement of a faculty member to create, conduct, and to develop and complete a professional development project while enrolled in the DPT program. The individual that wins this award is selected again via input from faculty and external reviewers during the research day presentations that we had yesterday. I'm pleased to announce that this year's individual Outstanding Applied Discovery Project is Jacob Miller, with faculty mentor, Dr. Stacy Frew. Our next award is the Contributor Award. The recipient of this award is chosen by the faculty and recognizes a student who consistently and intently contributes to a positive class atmosphere, who actively supports and engages fellow classmates, and who has contributed to professional endeavors outside of the classroom. I'm delighted to introduce Joya Wood as this year's Contributor Award winner. And my last award is truly an honor. I've been involved in academic physical therapy for over 20 years, and it's the first time that I've had the pleasure of introducing a graduate who scored the highest score on the National Physical Therapy exam that is granted, an 800. Allison Martz, please come to the podium and accept this inaugural award to the 800 Club. And now I'm going to invite Dr. Darren Webb, our Director of Clinical Education, to present our Clinical Education Awards.
Clinical education is a vital component of the WMU DPT curriculum, comprising approximately 25% of the program's time and 15% of its credit hours. Students participate in 3 10 to 12-week clinical rotations, providing them opportunity to apply, develop, and integrate their clinical competencies. The Clinical Achievement Award is selected from nominations submitted by clinical instructors and ratings on the Clinical Performance Instrument, or the CPI, across their 3 clinical experiences, assessing 12 specified professional and clinical practice criteria. Each of these students in the 2025 cohort have achieved a great accomplishments over the collective 90-some clinical experiences and deserve noteworthy praise for their clinical performance in one way or another, growing and maturing as professionals and exceeding expectations to a degree that we could not have imagined. As faculty, we are so proud of each one of you and all of your clinical accomplishments. Now, I'm honored to introduce the student whose clinical performance exemplified these achievements. This student makes an impression on people wherever they go and whatever they do. And in doing so, the student nominated by their they were nominated by their clinical instructors of each of their 3 clinical experiences. So all 3 of their experiences, they got a nomination from their CI. Again, an impression no matter where they go or what they do. they leave an impression. The recipient of the 2025 Clinical Achievement Award, and Steve Leopard, his CI, is here to present the award, is Derek Zagon. Yes. On behalf of the WMU DPT program, I want to thank our clinical partners for the ongoing tremendous support of our program over the years and their excellence in clinical education. Graduates, I think it would be time to honor them with your applause as well. Today we honor two of these individuals who have demonstrated extreme efforts in educating our students. These individuals received nominations from our 2025 cohort and are most deserving of this recognition. The 2025 Western Michigan University Doctor of Physical Therapy Program Site Coordinator of Clinical Education Award goes to Dr. Angela Hexel. The 2025 Western Michigan University Doctor of Physical Therapy Program Clinical Instructor Award goes to, and I assure you there was no quid pro quo, Stephen Leopard. Next, I'll ask Dr. Preston to come and, I'm losing my place. That's weird. Technology. So Dr. Preston will come and acknowledge those students who have received awards at our Michigan APTA State Conference.
Students, please stand as we acknowledge your award. The Michigan APTA Outstanding Student Award is given to one student in each of the 7 DPT programs in Michigan, each of whom are nominated by their faculty. This year's WMU award recipient was Matthew Corrado. In 2024, Michigan American Physical Therapy Association granted the Diversity, Equity, and Inclusion Award to Elise Eccles. Now we would like to recognize those students who conducted research that has been presented at either national or state conferences, or whose research has been accepted for publication. Again, students, please stand when you are acknowledged. Camden Eigenauer, Emily Hosmer, Quinn Loosely, and Riley Tuttle, with faculty advisor Dr. Carrie Barrett, for their work, Mild Traumatic Brain Injury in Older Adults, Provocation Evaluation, a Pilot Study. Danielle Macias, Allison Martz, Caroline Meyer, and Elizabeth Wardell, with faculty mentor Dr. Yvonne Jackson, for their work exploring the academic and clinical factors influencing standardized pediatric outcome measures. And lastly, Olivia Brunner, Connor Lynch, Juliana Roller, and Chloe Tomasic, with faculty advisors Dr. Rodney Weir and Dr. Heather Renter, for their work, A Qualitative Needs Assessment, Educational Gaps and Needs Among Informal Caregivers Providing Physical Assistance. Finally, I'll ask Dr. Smith to the podium.
Class of 2025, congratulations. Finally, I will be asking the students to stand and be recognized. The students, WMU students have been fortunate to be benefactors of this. Strike that. We'd like to recognize two students for their considerable efforts in helping the faculty and administrative staff in countless ways over the last 2 years. Our graduate assistants, Olivia Brunner and Matt Corrado. Additionally, each year, student cohort ambassadors are elected by fellow classmates to serve as class representatives and liaisons to the faculty throughout the duration of the program. The 4 students who served in this role are Olivia Brunner, Jesse Foreman, Brett Tracy, and Joy Wood. Would you please stand? All right, and finally, WMU students have been fortunate to be benefactors of the Solstice Foundation Scholarship run by Steve Leopard, which is a philanthropic effort that supports physical therapists and physical therapy students in impacting their community. The DPT class of 2025 Solstice Scholarship Award winner are Juliana Roller and Matt Corrado. Congratulations.
We have some impressive students. Congratulations to everyone in the DPT class of 2025. You've done and will continue to do amazing things, which you've heard loud and clear today, hopefully. You'll make us all proud. At this point, I'd like to present the graduates who will be receiving their doctoral hood and pin today. The doctoral hooding ceremony dates back to the 12th century. It's a special recognition of having completed your degree and is an introduction into your professional careers. Students, I'll ask you to stand by row and make your way to the podium. As Dr. Weir calls your name, please come across the stage to accept your hood. As you leave the stage, please accept your Western Michigan University Doctor of Physical Therapy pin from Dr. Fruth.
Jesse Foreman. Robert Lipsy. Brett Tracy. Brandon Hubbard. Quinn Loosely. Nick Mitchell. Luke Hainstock. Tyler Morell. Camden Eigenauer. Jacob Southworth. Derek Zagan. Riley Tuttle. Jacob Miller. Matt Corrado. Allison Martz. Caroline Meyer. Juliana Roller. Danielle Macias. Isabella Michaela Insamwa Miller. Jeffrey Lepley. Jasmine Martinez Page. Jordan Kowalski. Emily Hosmer. Olivia Bruner. Elizabeth Wardell. Bobby Kripe. Connor Lynch. Chloe Tomasic. Joya Wood. Elise Eccles.
Students, please stand. I'm going to ask that you pick up your program, and we're going to recite the oath on the back with me. I'm going to read the little preface, and then we'll do the repeating for the bullets. Capiche? In the presence of my classmates, family, friends, and faculty, and in view of the honored profession I am entering, I solemnly and willingly pledge that I will respect the rights and dignity of all individuals. Yeah. Perfect, you got it. Act in a compassionate and trustworthy manner. Exercise sound professional judgment. Demonstrate integrity for the enhancement of patient care and the advancement of the profession. Enhance my practice through lifelong acquisition and application of knowledge, skills, and professional behavior. And participate in efforts to meet physical therapy and healthcare needs of local, national, and global communities. Thus, with this oath, I accept the duties and responsibilities that embody the physical therapy profession. Congratulations, colleagues. And for our closing remarks, the graduates have asked Dr. Fruth to offer some final words of wisdom.
You did it. Sweet. Every year I write this speech with very little time to spare, meaning this morning. Not because I procrastinate, but because I want every aspect of this semester in my rear view to focus on what I want to say and honor this moment with all of you here together one last time. I told my inner blue to stay at home. Green, come on. So the first thing I did this morning was pull up your cohort mugshots. These orientation day photos from the day you stepped into this program. It was so tempting to project these. You're welcome. And instantly, memory lane took me back to who you were then. A group full of both excitement and uncertainty, ready for something big, but not yet believing in what you were capable of. You were stepping into a program that demands a lot, mentally, physically, emotionally, and you started to figure out that PT school is way more than memorizing origins and insertions or figuring out how the mechanics of a squat pivot transfer work, but it's also about discovering who you are when things get really hard. I have the privilege of spending so much time with you during what I like to call the messy middle. That season where you've excelled in your pursuits to get into PT school, but are realizing how far you have to go in just 2.5 short years to reach the ultimate goal. It's the season when stress levels are high, when confidence wavers, when you're convinced you'll never remember all the landmarks, never master a gait belt, remember that? Never pass that practical, never feel like a real PT. I watch you wrestle with doubt, fear, frustration, being utterly overwhelmed and exhausted, wondering if it will ever get easier. And then time passes, and you make it through fall of your first year. You pass the OSCE. Does that not seem like a lifetime ago? Wow. And then you head out and you crush that first clinical. That's when the first real transformation happens. And let me tell you, from seeing you day one in palpation, when 79.2% of you did not know what the olecranon process was, I went back and I looked at the stats today. From then to coming back just 1 year later after that clinical was done, that transformation was profound and amazing to see. And then I blink a few times, and you've marched right on through an incredibly tough fall and spring semester of your second year, and are back out in the clinical world, and then back in the classroom for a bit, and then out for 12 weeks for that final clinical. And then you're all done. And suddenly I see the you that made it through. The you that celebrated at Roadhouse last night and wherever else you went. Waldo's had a line. I don't know if you all persevered we taught you well in PT school. Get what you want. I saw the you that sits here today, grounded, capable, confident, and undeniably ready. Man, is that cool. But here's the thing I hope you never forget. The transformation happened because you showed up. Over and over, on days that were hard, days that were scary, days when quitting would have been far easier than continuing. But you showed up. And not only for you, but for your classmates. You got through this together. As Dr. Hoover likes to remind us, physical therapy is a team sport. And as he also mentioned today, life is a team sport. Right? He's right. So I believe I can speak for my fellow colleagues, my fellow faculty, when I say that we would be honored if we could continue to be part of your team. My one request is very personal and also simple. Stay connected with each other and with us. Remember these? These are the cards that you filled out on orientation when you had to write down 3 PT goals, 3 goals for PT. Right? And the ones I made you rewrite in proper A, B, C, D, E, F format. Remember that? Yeah, exactly. Well, I looked back through them all this morning. Yes, this is why I keep them. And well over half of you had at least one of those goals for PT school that said something like, make lifelong friendships, or form deep connections with classmates and faculty. So connection is important to you too, and that's cool. One of the greatest joys of my life is watching my former students evolve, professionally and personally, long after graduation. I love seeing you land that dream job, complete a residency, start a family, tackle a new certification, start your own PT clinic, move to a new state, move to a new country, share a life event that you could never have imagined on day one of PT school. whether it had anything to do with PT or not. I love bragging about you to future cohorts. I love seeing you return as guest lecturers, as the experts. I love watching you become clinical instructors for our students 1 year from now, just one. I love watching you serve as mentors. I love watching you become leaders who shape this profession. And I love referring patients to you. That's really cool too. But it's only possible if we stay connected. So don't disappear. Reach out. Join our alumni Facebook group. Visit. Tag us on Insta or TikTok if you share something really cool. Shoot me a text if you want to go to lunch, or if you want to come see the ponies, or hang out with Ripley. You know he would like that. Send updates. We would love to keep walking alongside you, and please know you always have a home. Love you all.
As we conclude our ceremony, I'd like to acknowledge our incredible administrative staff. A quick round of applause for them. They're responsible for organizing this ceremony and our reception to follow. And so at this point, I'd like to invite everybody to join us downstairs in the atrium for a reception that goes until 6. Thank you, everyone, for coming to celebrate this accomplishment. Congratulations, class of 2025. You've left a big impact, as you can see. Hopefully, you've all picked up on that today. If you could wait while the faculty and students process out before you leave, that'd be fantastic. Have a great night. Thank you for coming.